I thought at this point, having spent the last year promoting my educational book, and, as well as writing blogs on my website, I thought that now that the second book coming out, which is a memoir entitled Paul Golden, MD, My Life as a Physician with Bipolar Disorder. This should be coming out within a month, and I thought that rather than continue to write blogs on my website uh, of an educational nature, I would start talking about or excerpting parts of the book that's coming out soon. So this next series of videos and blogs will be about me. I think a good place to start is when I first realized I had a problem. That was in 1973 in my third year of medical school. Nothing particularly was changing or had happened. No misadventure or loss had occurred. And yet, for some reason, I was waking up in the morning around 4 a.m., not wanting to get out of bed, not wanting the day to appear, and of course, being very tired and forcing myself to get dressed. I did go off and do some surgical rotation work in the hospital every day, but as it got to the point where I was not only anxious and having what I call morning terror about the coming day, other emotions began to come to play, such as feeling guilty, um, yet I was responsible for no one but myself, feeling hopeless, uh, feeling that I may not be able to continue. Um, I never considered suicide, uh, maybe because I really didn't know what was going on. I have to say that even though I was a third year medical student, I had not had any instruction regarding mental illness. The first 2 years were book work, and then the next 2 years, including the one that started in 1973, were surgical and medical rotations. What I didn't know is in the fourth year there would be a psychiatric rotation. At any rate, after several weeks or a month or so of just feeling that I was deeper and deeper embedded into the ground, uh, I it dawned on me that this was a psychological problem. I then called the psychiatry department at Washington University, which is in Renard Hospital, and got a hold of a secretary who makes outpatient appointments for medical students. She said, "Well, I can get you out in about a week." And there was something in my voice, I guess, that made her realize that this was something that needed to be dealt with, and now. This was a now thing. So actually, she got me in to see Dr. James McClure that very afternoon. He saved my life. You can imagine that something like this occurs at this age, in the middle of training, heading towards a career, to have some life-threatening event occurring out of the blue, very scary. Uh, Obviously, I was pessimistic. But he used the words agitated depression. So that's what I had, an agitated major depression. He prescribed Librium to try to take the edge off, and I took that for a week. I think I was seeing him once a week, to no avail. And then he added amitriptyline, which did nothing except make my mouth dry and make it hard to have a bowel movement. Other drugs were tried of a similar nature, the tricyclic drugs, including tofranil. And we're now about 4 weeks into this myself and 4 weeks into this with him, and nothing's happening. I'm getting worse. I can't remember if I actually had to take time off before the crisis happened. But anyway, one night I was driving aimlessly in St. Louis um, in the evening, and I decided to just go to this bar and grill run by the sister of a friend of mine. I got there, and there were three of my medical school buddies at a booth, and I sat down, and they were laughing and carrying on, and I couldn't smile. I couldn't. I felt uh, I felt sad that I couldn't laugh. So I only stayed about 15 minutes, and then I got in my car, and then had no particular place that I was heading. Soon, actually, I became disoriented and didn't know where I was. But eventually, I found the way to the Barnes Hospital emergency room. I went in the back entrance and went down the hall, and as I vaguely recall, I was screaming and crying. And the next thing I know, the next morning, I awoke in a padded cell with barred window. I subsequently was told that I was given Thorazine IM. Dr. McClure had not been on call that night, but he saw me the next morning and rapidly switched me from the sixth floor, which was the floor for schizophrenics and other psychotics, to the third floor, which was for the affective disorder patients, affective as in A, which includes major depression disorder and bipolar disorder patients. Again, for about 2 weeks, all different drugs were tried, even antipsychotics. I remember Stelzine for one. And I eventually got a private room. I felt I was improving some, and I was to go home the next day. Now we're about 2 weeks into that hospitalization. That last night, I sat in the corner of my room, almost shaking. And when the morning came and Dr. McClure came around, I said, I'm not any better. I'm not ready to leave. And could I have electroconvulsive therapy? He brightened right up and said, absolutely. I think he was waiting for me to decide that that's what I needed. Well, this turned out to be a miracle because after 3 treatments, I was back to being Paul again. So the treatments are given every other day, so 3 a week. It involves a very quick procedure, which I'll describe on another sitting. What I want to emphasize is that after 3 treatments as an inpatient, I felt back to normal. I then went home and I returned every other day for a total of 8 treatments, and went back to my hospital rotation on no medications. I do credit Dr. McClure for saving my life. I had luck. I was lucky to have access to a psychiatrist quickly, being in a university setting, and I was lucky to have him because we got along well. In subsequent visits, he even wanted me to tape record my story so he could play it for subsequent medical students. So I finished the 3rd year and then the 4th year. Actually spent part of the 4th year in Israel doing what's called an externship, as I knew a professor there. More about that on another video. I then went on to University of California, San Francisco Medical Center, where I would be a resident in internal medicine for 3 years, from 74 to 77. On another time, I'll talk about my second major depression, which occurred in 1977, rather 1976, in my second year of residency in San Francisco. And I'll talk then about what I did and how Dr. McClure helped me again. These are the pertinents. These are my memories. These were bad times, and these were good times. The bad times came first, and then the good came back. And Paul came back. Until we meet again.